Hi, my name is Lane Trinkle. This is my final reflection video over orthopedic evaluation and diagnosis of lower extremity. My areas of strength, I believe, over the course of the semester, I think I've done a really good job improving on gaining a history from my first practical or SP, where I really didn't take that good of a history. I kind of got the pathology in mind from a couple questions and then went with that and jumped right into palpation and special testing. On this SP, I think I took probably 5 to 7, 8 minutes to just take the oral history with the patient. I pretty much hit everything I wanted to hit in the history questions. Today I didn't really forget anything except for what point in the season were they in, and I didn't really ask if this was a sport-related injury during the history evaluation, but later on I did kind of get that out of her. I think right before we jumped into special testing, I asked her what sport she played, but she told me rugby, and then I asked if the injury occurred during sport-related activity. She said it was during lifting, so even the points that I think I missed during the initial oral evaluation, I think I did a pretty good job of going back and reiterating and hitting those points throughout the evaluation. Areas of improvement, definitely fluidity of the evaluation. I didn't do a good job at all of hitting all my palpations, all my range of motions, all my manual muscle tests, all my special tests at once. I kept going back and had to just go back and forth between manual muscle tests, range of motions, and special tests. For the most part, I think I hit my palpations really well. I think I could do a better job of kind of palpating. I wouldn't say structure. I know what I'm palpating for when I am palpating, but knowing where to palpate, I guess, is. So I had an idea that it was SI joint dysfunction. I knew to palpate the SI joint, which she was tender at, and I didn't really know what else to palpate for, so I palpated the spinous processes of the lumbar spine. I palpated the PSIS around the iliac crest, the musculature around it, and the ASIS. I just feel like there could have been more palpations. Also, that was still a lot better than my first one. My first one, I believe I palpated maybe 2 or 3 structures, so even that didn't go as well as I would have liked to in the initial, or it got a lot better from my first one to my last one. Another area of improvement where, with the fluidity, where I was talking about that is I was going back and forth from manual muscle testing to range of motion to special tests, and I was just going back and forth between those 3 things, and I just wish that I would hit all my manual muscle tests, all my special tests, and all my range of motions. But I did improve from my first one, because my first one, I got the pathology in mind, and I didn't do any special tests to rule out anything. So it was SI joint dysfunction, and this one was SI joint dysfunction, and I did the SI joint cluster, which were all positive, but I still ruled out spondylolysis with the quadrant test and Stork test, which I think was kind of big for me anyways, because I know the first one, I don't really remember what the pathology was. I just know that I did like 2 special tests, which ruled in the pathology, and then I didn't rule anything out. So that was I think big improvement for me anyways, to remember to try to rule out some pathologies. Don't just focus on ruling in. So I think that's a big place where I've improved over the course of the semester. I was with ISU men's basketball for the second 8 weeks, and we didn't have any injuries. So clinical evaluations, I haven't really had the chance to do any of those. So SPs are where I get my practice for those, anyways, for the past 8 weeks anyways. So I think I did really well with not having a big clinical experience of getting the learning opportunities the opportunities to do evaluations. I think I've done pretty good at just trying to hit on key points during evaluations, especially like I said, the oral history part. The last thing I think of for improvement is my manual muscle testing. Uh, for the most part, I did large muscle group manual muscle testing. So like I tested all the hip flexors, I tested all of the hip extensors. I didn't really isolate anything, and also I did a couple of them where I was in my head testing one thing, but in reality I was testing another thing, which I realized that while doing my SOAP note. So I guess I kind of like saved it on the SOAP note, but I think an area where I can improve over the next semester is quick thinking on what muscle I'm testing and what motions I'm trying to get the patient in. So for the TFL, I just did hip abduction. I didn't put the leg forward at all. So there's just small little things with manual muscle testing that I'd really like to work on and improve over the next semester. Overall, though, I think that I've improved a heck of a lot over the course of the semester, from gaining an oral history and actually hitting key points and also ruling out pathologies. I think I did a really good job improving on those things. Obviously, there's still room for improvement. You can never be perfect at these things, and I understand that. But I think I've made a pretty good leap over the course of this semester, getting better at doing evaluations and trying to diagnose an injury. Thank you.